So if we want to deal with ankle issues that can be a big factor with any athlete, but particularly one in CrossFit that has to do a lot of squatting motions, the ankle in and of itself can become locked down and have some mobility issues, or they can have a sprain strain where they need some stabilization. What we'll do is the laser will come in and we're going to laser around the entire ankle mortise, so all around from the outside lateral edge up on top to the talus, down on the inside, and even go from up underneath to the bottom of the foot to get from there as well. So you want to cover the ankle joint and what's called a 360, go all the way around the entire ankle, and have the client move the ankle as well as you're doing it. So if they want to go into flexion and extension, and if they want to do circumduction where they just kind of go and roll it a little bit, this one you can use the massage, or you can lift off a little bit, or use the cone, whichever you prefer. So I will typically do laser first, and if you want to go in with any soft tissue technique, release after that, or if you have it in your scope of practice to do a mobilization, you can release the joint after you laser it first. And then we're going to go in and give some stabilization tape to the ankle, and I'll show you how you can do it depending on whether the foot is supinated or pronated, where you want to start. Most people who have ankle issues, it's because the foot is pronated or flat. So by how we use the direction of the tape, we can put it into a little bit of supination as we support it. Alright, so now we're going to give some stabilization tape to the ankle. So if I want to do a little supination on the ankle, I'm going to start here on the inside, come around and actually add a little bit to this. If I want to do some pronation, I'll start on the other side and turn it out, okay, or what's called inversion. So I'm going to start right here with the anchor tape, come right over the ankle, and I'm actually having stretch the tissue, turn the ankle in a little bit, and then when I'm underneath there, because I want to give a little supination to him, I'm going to put a little stretch on the tape to get him into some supination. Then it's going underneath the foot, and now he's going to turn his foot out, stretch this tissue. I'm going to come up and over, then I'm going to crisscross over the front, and I'm going to come up a little higher on here because I want to get into these peroneals, which are usually tight on a lot of people. So then I can hook in here. And if I need more stabilization, I can add another strip of tape over this, so I can double it if I need to get more in there. And say if he had a sprain, an inversion type sprain, and he's swollen out here, or if I want to give some stability in here right over the ankle mortise, I'm going to actually do my decompression there. Pull here, stretch about 100%, back off 50%, come right over that talus, wrap around underneath, and come in the other way. And now the little bit of a pull on the tape should have him into the position that I want him to go into. So if you make the ankle a little bit more stable, it'll actually give you a little bit more range of motion.